I'm Dr. Nabeela Ali, Chief of Party for Pakistan Initiative for Mothers and Newborns, which is a USAID funded project for 5 years, and also the Country Director for John Snow Inc. in Pakistan. I'm a medical doctor and worked for 14 years with public sector, then moved towards private sector. And now the program is working at the national level in all 4 provinces and also in FATA. The situation of maternal and newborn health in Pakistan is not up to the mark, even if we compare with the situation in the region, Bangladesh, Nepal. We see that most of the health indicators related to maternal and newborn health are not optimal. And we have to do something about that. And that is why Ministry of Health is working with other partners, development partners, and with private sector to bring a positive change in the lives of mothers and newborns in Pakistan. It is very disappointing to see that maternal mortality ratio in Pakistan still stands at 276 per 100,000 live births, which by all standards is high. No mother should die, because this is highly unacceptable that mothers are dying because of reasons which are preventable. Likewise, the situation of newborn health is also very glim, and we have to do something about that, and that is why Government of Pakistan initiated Maternal, Newborn and Child Health Program, which is for the first time government's own program addressing the health of the mothers. So the other development partners who are working with them, they are USAID, UNICEF, UNFP and WHO, and all of them are trying to reach women behind the walls. Still 50% of women do not have access to tetanus toxoid immunization. They do not have access to antenatal care. Likewise, postpartum care is very, very low, and that is the time when majority of mothers and newborns die. The first 2 days in the life of the newborn are very critical, because that's the time when the newborns die, and we all know where the births take place in Pakistan. Majority of babies are born in the rural communities, and we all know that 67% of population resides in the rural areas, where there's lack of access to skilled birth attendants. And 80% of the deliveries are still by traditional birth attendants, who may or may not be trained. So in the absence of skilled birth attendants, we see that the first 2 days in the life of the newborn are critical, and likewise the first week after birth for maternal mortality is very, very important if we want to avert that. The skilled birth attendants, they are based in the health facilities, and now the new initiative of Government of Pakistan, where all development partners are also supporting Ministry of Health, is to introduce the cadre of community midwives. These community midwives, they are selected from the union councils at the rural, at the district level, and they work in their rural communities providing services to women, so that services are brought closer to the doorsteps. Ministry of Health's target to train 12,000 community midwives in the next 5 years is not enough, and we have to double up this effort. But in order to do that, we need the infrastructure, we need the training institutions, we need tutors, we need laws, rules and regulations where these community midwives are going to perform. So these are areas where the government is focusing these days to provide services where they are most needed. In Pakistan, the major causes of maternal mortality or maternal death are excessive bleeding and lack of access to health services. Likewise, for the newborn, birth asphyxia, that is difficulty to breathe, infections, and low birth weight babies. We are still struggling with issues which are mostly related to primary health care. So with this situation of maternal, newborn and child health in Pakistan, there is a lot that needs to be done, and we need to work in partnerships. Government alone cannot provide services to the masses. For this, public-private partnerships are very important, because business as usual will not work, and we'll have to think outside the box. Government is now very open to work with private sector, because we all realize that 70% of patients and clients, they go to the private sector. And private sector in Pakistan is largely unregulated. So we have to work on one end with the public sector, improving the quality of care at the health facilities, as well as develop linkages with the private sector, and work with the rural communities to create awareness so that they can access and they can utilize the services which are being provided through the static health facilities. And the whole program, outreach program, through the lady health workers and through the Ministry of Population Welfare Extension workers, they have to reach out to provide immunization services, to provide awareness regarding maternal newborn health, and disseminate the key messages so that women can take care of their own health as well, because we believe that it's a shared responsibility. Women have to work at their own end, look at their health, take proper rest, utilize the services according to the schedule which has been shared with them through the lady health workers and community midwives. Likewise, at the health facility level, the healthcare providers, trainings, orientation have to be according to international standards so that the standard protocols are followed and we provide services which are acceptable and are affordable and quality services. In Pakistan, the potential of private sector has not been exploited, I would say, at this point in time. And we need to find ways how to work closely with private sector or in harmony, public sector, private sector in the rural communities, how the civil societies can play their role and reach out to people where the services cannot be reached through the public sector. So this is something that has to work in a very organized, coordinated manner. The Executive District Officer Health plays a vital role because with his team, the District Nazim, the District Coordination Officer, and the EDO Health himself along with his team, they have to set some targets to achieve for their district. They need to understand what is the situation and how they can improve. And that is where I'm playing a role through my project and through my organization and the donors who are supporting this project to bring a positive change, to come up with strategies which are realistic, which are implementable, and we can work with government, private sector and civil society to provide complete coverage at the district levels so that no woman dies unnecessarily and no newborn dies unnecessarily because of reasons which are preventable. Civil societies can play an important role because they understand the language, the local culture, beliefs, taboos which are prevalent. So they understand their communities well, and they can work hand in hand with government to provide these services which otherwise people are not utilizing. So to bring the whole behavior change, a very standard communication strategy is required, which is based on research, so that we can come up with key messages and not only work through interpersonal communication, but utilize the media. Media plays a vital role in reinforcing all the health messages and in reaching out to a broader population and public. So the coordinated efforts between the groundwork which is being done at the district level, services which are being provided through outreach workers, as well as mass media messages so that it brings credibility to the whole campaign, is so essential. As I said earlier, maternal newborn health is a shared responsibility and each one of us has to play an important role. Here I would like to emphasize on the role of policymakers, the parliamentarians, the elected representatives, that they have to prioritize health. They have to allocate more resources towards the health of mothers, newborns and children in Pakistan, because as I said, the statistics are not heartening and we have to improve these. Working in collaboration with private sector, improving the quality of services which are offered through the health services, ensuring that these health outlets, they provide services round the clock. so that the trust of patients and clients is maintained and they can come and access these services. So I would just like to emphasize on the importance of having good strategies which are based on research, which are based on the ground realities, and then work towards achieving the larger goal of improving maternal, newborn and child health in Pakistan. And inshallah ta'ala, we can bring a positive change. There are many success stories within Pakistan for which we don't have to go outside. We have to just keep our eyes open and work in partnership with Ministry of Health, try to support each other and move forward.